Hello, I'm Miguel Toribio-Mateas, the Clinical Director at the Optimum Health Clinic, and I'm here today with Lesley McLauchlan, who is in our nutrition team. Hi Lesley, how are you today?
I'm very well, thank you.
So today we're going to be talking with you so you can introduce yourself to our viewers. How did you get into nutrition to start with? What motivated you to start getting into nutrition?
I think what motivated me more than anything else was that I really wasn't well as a child. I had a lot of immune system problems. Looking back now, I think I had intolerances to both wheat and dairy. I had a lot of digestive problems, and I was always at the doctor having antibiotics, which, I spent a lot of my childhood being quite ill. My diet wasn't that great either. I had a mother who worked full time, and at that point I think was quite interested in ready meals because that was easier, and gave us lots of sugary things, which I think made me even worse, made my health deteriorate a bit more. And then I had quite a lot of stress with parents divorcing around the time I was 10 or 11, and I actually ended up with ME at 14 myself. Looking back now, seeing all of those things that I've just mentioned being potential contributing factors to
So
that.
you've gone through the process of experiencing ME yourself, and you are very familiar with how you can get to that point.
Yes, I was actually bedbound for about 3 months. I had probably in total about 6 to 8 months off school at actually quite a critical time. And I was reading quite a lot around nutrition at that time. At the time I wanted to go into a career that was related to food and nutrition. And just, with my mother's help, she supported me, we started changing diet, and gradually I managed to get myself better and back to school, and without too many repercussions. But I know, stress is quite a big factor when you have a major stressors going on in your life like that, and how much they can have an impact on your health.
Okay, that's very interesting. Thank you. So I guess my next question for you is, how did you get to work with what got you interested in working as part of the team here?
Well, I suppose the ME aspect attracted me to it. I had been working with another practitioner specialising in Candida and food intolerances before that. And I was looking to sort of further my work and experience as a nutritional therapist, and saw the advert at OHC and thought that I could probably add value there based on my own experience and the experience that I'd had as a nutritional therapist anyway.
Brilliant, and I like to believe that is the case.
I hope so.
That's great.
Yeah.
And would you like to tell us something about yourself, something that you like to do in your spare time, something about Lesley as an individual aside from your work here at the OHC?
Okay.
Yeah.
Well, I enjoy. I live by the river, and I enjoy walking my little dog, who I inherited from my mother-in-law, who unfortunately died of Alzheimer's some years ago. So my little dog is 19 years old now, but she can still sort of walk a mile and a half twice a day generally. So I do a lot of walking. I also do Pilates and yoga 2 or 3 times a week, and I find that really helps me for relaxation, and cookery as well. I mean, I cook and test recipes constantly, so that's my, I can really lose myself in things like that. I like to paint as well, but it's fitting everything in really. But those are the sorts of things that I enjoy most.
Okay, well that's brilliant. Thank you, Lesley.
Pleasure.
Thank you, and thank you all for watching. If you're interested in talking with Lesley, you can give us a call and ask to have a 15-minute chat with her so you can explore more of your case with her personally. So thank you very much for your time today and see you again soon. Bye-bye.